Okay.
So in last class, we saw basic terms and their use as a landmark in orthopedic surgery. Today's topic is about bone classification. Bone classification. This classification is based on shape. This classification is based on the shape of the bone. The first type is the long bone. Why they are called long? Because their length is more than width. The length is more than width. These are known as long bone. So, if we see the part of long bone, this is the articular cartilage. Articular cartilage. And these two lines, they are your physis, growth plate. That is growth plate. So in case of a long bone, we have two parts. One part is bone and another part is cartilage. One part is true bone and one part is cartilage. In if we see these two structures on X-ray, on X-ray, we cannot see cartilage on X-ray. It means this articular cartilage and number two, this growth plate. These two structures, they are not visible on X-ray. It means epiphysis, epiphysis, this is visible on X-ray. Diaphysis, it is also visible on X-ray. And these two parts, these two start. These are known as metaphysis. This is metaphysis. So, if we look one long bone on X-ray, then suppose this is one example, scapula, then humerus. If we look on the X-ray, then this articular cartilage is not visible. This growth plate not visible. Diaphysis, metaphysis, and this epiphysis. These are visible on the X-ray. One more important point about the long bone part is metaphysis. Metaphysis. Metaphysis is a part of diaphysis. If this is the diaphysis, then these are the metaphysis. So the metaphysis is a part of diaphysis itself. And these two ends, they are known as epiphysis. They are epiphysis. So first we'll start with the epiphysis. What are epiphyses? we have proximal epiphysis, distal epiphysis. There are some types of epiphysis. Types of epiphysis. For example, suppose uh, this is one animal and these are the bones. This is femur and this is tibia and other bone. This the body weight of the animal is transferred from this bone to this bone to this bone then to the ground. So this is the way the body weight, or you can call it force or pressure, they transfer like this. So this is the way of transfer of the body weight, load, pressure or force. So if we see, these are the joint, these are the joint. This load these joints, they take up the load or force or pressure, whatever the term you can use. So these joints, they can take up the force, they can take up the pressure. So what is present at the joint? Just take one example of femur and tibia. This force is or pressure is transferred from here to here. These two surfaces, which these two surfaces which take the pressure or the load, these are the ends of the bone. So what we call them? Epiphysis. Ends are called epiphysis because they take up the pressure, they carry that load, they transfer that load from one bone to other. So they are known as pressure epiphysis. They take up the pressure. So pressure epiphysis, these are the pressure epiphysis. They are articular in nature because here we have joint. So they are the part of joint, they are articular in nature. So the MCQ is pressure epiphysis are articular in nature. What are the examples? If we start from here, femur, head of the femur, head of the femur is pressure epiphysis. This body weight is here taken up by the head of the femur. Then it will transfer here at this joint. These two are condyle. So condyles of femur. Then tibia. So these articular structures which take up the pressure, they are known as pressure epiphysis. Head of the femur, condyle of the femur and head of the tibia, like this. If we see, here is the scapula and then humerus and we have radius and this is ulna, RU. So Pressure epiphysis is over where head of the femur and condyle of the femur. But if we look at the structure of bone, this is the head. There are some projections. There are some projections on the side of the bone. Here, some projections on the side of the bone. These are known as epicondyle. These are known as epicondyle. And and there is lesser trochanter. If there is numerous tubercle, there is lesser. So these structures which are on the side, they are formed by the pull or terminal, some tendons, some ligaments. So in one diagram, if we try to understand here, this is acetabular cavity, head, femur, and these are the condyle. See, this pressure epiphysis. Condyle are the pressure epiphysis. Greater, lesser trochanter, and the epicondyle. Epicondyle. Structures which are present on the side. Suppose this is bone and structure present on the side. These are the structure on the side. Are known as an epiphysis. Why they are called traction epiphysis? Because they are formed. These projections are formed on the big traction. Traction means pull because of pulling of. These are present at the end of the bone as epiphysis. These are formed because of traction, so they are known as what are all the structures present on the side of the, like greater tubercle, lesser tubercle, condyle, epicondyle. The difference between pressure or traction epiphysis. They articular. They are part of a joint. They take up the pressure. But these are non-articular. These are non-articular. This is the important difference. One diagram. Just see scapula and humerus. This is pressure epiphysis. Great circle, that is traction ep. Then come head of the radius and your ulna. This radius, this part which is taken, that is the articular. And on the side, this is non-articular. The role, what is role of traction epiphyses in the body. They are the insertion or origin of the some are insertion, some are the traction epiphyses. Number three, that is the atavistic epiphysis. Atavistic means something which resemble to your ancestor or resemble with lower class of animal. It means which is present in animal which is full in case of human being or in case of domestic animal, it is present the remnant. For example, scapula of human. Scapula of human being. Scapula is having something called as coracoid process. Coracoid process. That process, coracoid means beak-like process. This is a small beak-like process. So this is present in human being. But if you go to lower class, this coracoid is not a process. If you look at the bird's pectoral girdle, the bone, and we call that coracoid. So bird's pectoral shoulder girdle, pectoral. But in case of human being, this bone is represent a small process called as coracoid process. This is the example that atavistic epiphyses are nothing but projections or small epiphyses which are well developed in case. Like this coracoid process is simply a small beak-like process, but in birds it developed coracoid bone. Three types of epiphyses. So in case of long bone, we are done with the epiphyses. Epiphyses, that is head of femur, head of humerus, condyle, trochlea, these then traction epiphyses like greater trochanter, minor trochanter, greater tubercle, lesser tubercle, and last one the atavistic epiphysis. Come to this structure. Just below the epiphysis, this is growth plate. Related with this, it has a link with your ortho surgery. There is classification, Salter-Harris classification. So classic that is 1 to 5, but recently type 6 is also made. So what is Salter-Harris classification? And Salter-Harris classification is the something with fracture of your growth plate, fracture of your physis, where not only physis, in some Some part of metaphysis also involved. In some type, epiphysis also involved. So the physis, this is epiphysis and this is metaphysis. Type 1, 2, 3, 4 and 5. First we'll see type 1 itself indicate make. So type 1 is fracture through physis, fracture through the physis. So this is the physis fracture through the growth plate. Type 2, in this structure make two like this. The tail of is through the growth plate and the head of the two is through the mat. So in case of type 2, fracture through the physis and metaphysis. Metaphysis. This is the physis. Small part of metaphysis is also involved. Type 3, Salter-Harris. Type 3. So we can make like this. It means the fracture is like this. Make 3 through the physis and through the epiphysis. So type 3 is through growth plate, that is physis, and through this epiphysis. Metaphysis is not. In case of type 4, 4 like this, like this. The straight line means fracture is through physis plus this part 4. It is entering to the metaphysis. The meta is also involved plus straight line. It is splitting your epiphysis. So epiphysis. So type 4 Salter-Harris is through the metaphysis, physis and through the epi. Next is type 5. Number 5. 5 means physis. This is 5. 5 means physis. There physis is crust. It means you cannot see physis. That metaphysis is directly connected with the epi because it is. So these are type of Salter and Harris classification. Salter, fracture. This is simple normal structure. Your metaphysis, physis, and this is the epi. What is type 1? Simply draw 1. Type 1. What is 2? Draw 2. What is type 3? Draw 3. It means like this. 3. What is type 4? Draw like 4. through the metaphysis and S. So it's very easy classification. 1, this is, and 3, and this is 4. Now 5 is nothing but the crushing of the growth plate. So our topic was long bones, where we saw the part of the long bone, articular cartilage, see, epiphysis, B-type, then physis, shoulder classification. Then in long bones, there are something elongated long bones, and ribs. The most important MCQ about the ribs is medullary cavity absent. Medullary cavity is absent. Then, in case of long bone, something called aborted long bones. Means the bone is long, but in between it is like ulna of horse. It This is the radius. The ulna is something, it finished here only, not reaching up to the lower end. That is the abortion, our long bone, ulna of the horse. Then number 2. Number 1 was the long bone. Number 2 is short bone. They have a shape that is most common is the cuboidal. Mostly they are cuboidal in they are about short bone. They have a length equal to width. Not exactly, but roughly length is equal to. If we look at the short bone structure, there is more cancellous. There is minimum cancellous bone, which is a thin layer covered by thin compact bone. Example: tarsal, the small bone, for example, is your sesamoid. So in short bone, we'll discuss about these. They are very important bone. Sesamoid. They are small, just like a seed. Seed like. They are found. They are found close to joints. In case of dog, if you look at the stifle, cranially, if you look from the front, you will find patella. If you look caudally, you will find two sesamoid bone called fibula. In case of horse, they are also found near the joint. For example, fetlock. For example, coffin, proximal sesamoid. Here, distal sesamoid. Navicular, navicular bone. So, most commonly, these small rounded structures joint. Dog stifle joint, there are three. One that is patella, two on the back side. They are the fibula. The femur, distal femur. In case of horse, fetlock joint, proximal sesamoid, and coffin, navicular bone. Where they develop inside tendon, inside tendon. Rarely, rarely inside ligament. That is very, so most commonly where they develop inside the tendon. What is the example? The back side of distal femur. This is medial condyle. This is condyle. Here you will find medial fibula and fibula. Here is the head of gastrocnemius. So head of the gastrocnemius muscle originate from these two fibula. Out of this medial and lateral, this largest sesamoid bone of these two fibula. Lateral is the largest. So this is on the back side of the distal femur. If you look at the front of the front, this is back, this is front. Front we have trochlea, pulley-like structure, and over the trochlea we have patella. And which tendon is related with this? Quadriceps femoris. Quadriceps femoris tendon. Here we have mid condyle, lateral condyle. We have medial fibula, lateral fibula. So this is the side of femur, that is posterior, and this is the anterior or cranial aspect of femur, where there is trochlea, patella is sitting. And which muscle with this? Quadriceps femoris. And here, head of which muscle? Gastrocnemius. It is related. So remember these two sesamoid bone, fibula, patella, and in case of navicular bone and proximal sesamoid. So we are inside the tendon. One more important point about bone is these bones periosteum. No periosteum. No periosteum means periosteal blood supply. There is a fracture of these bones. So there is blood supply. There is no healing. There is no healing of fracture. And called delayed healing. Delayed healing. So sesamoid bone, small round structure found near, they develop inside a tendon. They do not have periosteum. So no Till blood supply, no or delay healing. One more important, no medullary cavity absent. One more important, they have only one articular surface. The patella is like this, which is having only one articular surface over the. These are the points related with the sesamoid bone. Number two was short bones, and number three is the flat bone. Flat bones, there is one term called dipole. Term is called dipole. Dipole means these bones, they have two poles. Centrally, they have can tissue of villus bone. On the outer side, surrounded by compact bone. They are so this center one is the thick cancellous bone, the thin layer of compact bone. Which bones are flat? Scapula, bone of the face. They are the flat mandible. But in all these, the important point is the type. That is maxillus bone, minimum cortical bone. These flat bones, they are formed by which ossification? They are formed intramembranous intramembranous method. Number four is the irregular. Irregular means they do not have any shape, like your os coxa and your vertebrae. These are the number five, your visceral bones. They are formed by which ossification? That method is called neuroplastic ossification. So flat bones, they are formed by intramembranous ossification, visceral by heteroplastic, and long bones by endochondral ossification. Ossification. What are the bones? In which visceral organs they are present? So we start with the nose, os, rostral is present in the pig. Then with the eyes, os opticus, it is present in the bird. In the nose, there is one bone which is present in the pig, bird. Then if you come at here, from that is os phrenic. It is present in the here heart. Then os cortex. Bovine. This is present bone present in the visceral one MCQ. No medullary. Number one,